Welcome to The Explainer. Today, we're diving into something pretty groundbreaking in trauma therapy. It's called Deep Brain Reorienting, or DBR for short. And get this, it targets a part of our survival response that's so deep, so fast, it kicks in before you can even register an emotion.
So let's just jump right in with a big question, one that honestly puzzles a ton of therapists and their clients. Why do some people feel so stuck in their trauma, even after trying different therapies for years? It's like the echo of what happened just won't fade, you know? They feel trapped in this awful loop. Well, the research we're looking at today points to a really fascinating reason why. See, for a long time, therapy has focused on the story of the trauma, right? And the big, intense feelings that go with it. But what if that's not the whole picture? What if the real origin of the trauma, that first imprint, wasn't a thought and it wasn't a feeling, but a purely physical reaction, one that's locked deep inside the oldest part of our brain?
And that is where everything changes. This is the key difference. Think about it. Most therapies work top-down. They start with your thoughts. That's the cortex, and your emotions. That's the limbic system. DBR completely flips that script. It's a bottoms-up approach. It goes straight to the source, to the brainstem, the part of your brain running your most basic blink-and-you-miss-it survival reflexes.
All right, so what exactly is this deeper level we keep talking about? Well, it all kicks off in a tiny part of the brainstem that acts like the brain's first responder. We're talking about something that fires off way faster than you can think, even faster than you can feel fear.
Okay, so it's time to meet the star of our show, the superior colliculus. That's a mouthful, I know, but just think of it as the brain's ancient where system. It's like this built-in radar. So before you even consciously know what that noise was or what that shadow is, this little guy has already snapped your attention towards it. Its only job is to ask, where is it?
And this right here is the absolute core of it. DBR suggests that the reason people get stuck isn't actually the unprocessed emotion. It's something that happens before emotion, called pre-affective shock. Imagine that physical jolt, that tensing up, that split-second freeze. That all happens in the milliseconds right after your where system spots a potential threat, but before your emotional brain even has a clue what's going on. And in trauma, that shock sequence gets burned in, stuck on a loop.
Okay, so that's the theory. But how on earth do you access something that deep and that fast? Well, DBR has a really interesting method. It doesn't start by asking you to dive into all your feelings. Nope. It uses this surprisingly simple sequence that's anchored right in the physical sensations of your body.
The whole technique really boils down to this sequence, O, T, She, A. First, the O, you orient to the memory that's causing the trouble. Next, T, and this is key. The therapist helps you notice the orienting tension. It's that subtle tightness you might feel around your eyes, your forehead, your neck. That's your body physically trying to locate the old threat. That tension acts as an anchor. It lets you get to she, processing the underlying shock without getting overwhelmed. And only then, once that shock starts to release, does A, the affect or the emotion, get to come up and flow through naturally.
And that idea of orienting tension is really what makes DBR a game changer. See, that tension isn't a bad thing you need to get rid of. It's actually a handhold, like a guardrail on a scary bridge. By holding on to that physical sensation, you can walk across and process that deep pre-emotional shock without getting swept away by the flood of terror or grief that's waiting on the other side.
So this all sounds pretty incredible in theory, right? But does it actually work? Let's look at the impact. What really happens when you can finally heal trauma at this super deep brainstem level? The results are, well, they're pretty profound. The data really speaks for itself. There was a big randomized controlled trial back in 2023, and it found that DBR has a strong effect size for reducing PTSD symptoms. That's a huge deal, but you know what's almost as important? The study had very few people drop out, and that tells you something crucial. This therapy seems to be gentle enough for people who are in a lot of pain to stick with it.
And we're not just talking about one little improvement here. The impact was comprehensive. It hit all 4 of the major symptom groups for PTSD. We're talking about a decrease in reliving the event, less avoidance, improvements in mood and thinking, and a calming of that constant hyperarousal.
But honestly, the numbers and the clinical terms only tell part of the story. The real power of this comes through when you hear from the patients themselves. I mean, listen to this. Someone who spent years feeling totally disconnected from their own body finally said this.
And that one really hits home, doesn't it?
Trauma can make you feel like a ghost in your own life, just sort of floating, not really there. By getting to the root of that survival response, DBR seems to help people land back in their bodies to feel solid and present and whole again.
So all of this leaves us with a really provocative idea to chew on. What if, for some people, real healing isn't about changing the story they tell themselves? What if it's not even about learning to manage overwhelming emotions? What if it's about something much more fundamental, about reaching into the oldest, most primal part of our brain, and finally letting that ancient survival system know that it's safe now, that the danger is really, truly over?